Hi everyone, this is Deepu Gowda, Course Director of Foundations of Clinical Medicine Tutorials. I want to take a few minutes to describe to you how the bedside sessions work. A couple quick notes about even before getting to the bedside session. Those of you placed at the Bronx VA, I hope that all of you have had a chance to go through all of the clearance required to be able to be at this federal site. If you happen to be behind on that, please reach out to our course coordinator as soon as you can so that you can get on track and be able to start on time with everybody else. Also, you'll notice a module on CourseWorks called Infection Control Module and Quiz. So before you go to the bedside, it'll be required for you to do that and take the quiz to make sure that you've learned the material you need to learn. This is just a safety and quality issue. We want to make sure that you're adequately prepared to the risks of being, in a clinical space. So this is a standard kind of protocol. I think you've all seen this also earlier in your curriculum. So this is a review of material. So please make sure to check that out on CourseWorks and complete that before going to the bedside. You'll also be receiving a first day logistics document. It's going to be uploaded onto CourseWorks on your Bedside 1 session, and it will also be emailed to you. And basically, this will tell the folks who are going to their bedsides where they are supposed to go on that first day. If you're traveling, it'll tell you, where to meet your preceptor. It'll give you contact information for your preceptor in case there's any confusion or you can't find them. So please check that out and refer to that when you're planning your trip to your session for your site for your first session. Also know that at the bedside sessions we always give thank you cards to each patient. So one card per patient. So we handed those out earlier during orientation of the course. If for some reason you didn't get a packet, please reach out to our course coordinator who can get you those packets of thank you cards. And also folks who are traveling to, let's say, Harlem Hospital or Bronx VA or Allen Hospital, you all have been issued Metro cards, enough rides to cover round trips for the number of bedsides that you have during the semester. So please pick one up from Sion or our course coordinator if you have not done so already. But those should have also gone out during the first session. And finally, Zipcar cards for those who are going to be traveling to Stamford or Lawrence Hospital or Westchester. You will be driving up there, and so make sure that you've done all the necessary steps to get your Zipcar cards. If you're having confusion around that, again, reach out to our office. So thinking about the team compositions, for the bedsides, essentially it's one preceptor for 4 students. Students, if you line up students' last names alphabetically, student A is first alphabetically and D is last. And what you'll do when you go to the bedside is you will see the patient in pairs. So basically for a group of 4 students, you'll form 2 pairs, and the whole group will see 2 patients in total. One pair will see 1 patient. The second pair will see the second patient. If you're in a group of 2, you will also be assigned 1 patient. And typically what you'll see is those pairs will rotate every week. Every time you have a bedside, you'll switch in terms of your roles of who's interviewing the patient and who's doing the physical. In terms of how the session is broken up, those 3 hours, so the sessions always go from 2 o'clock to 5 o'clock, and it can happen on a Monday or a Thursday, so you've been assigned to one of those 2. Essentially at 2 o'clock, you should meet your preceptor. And, if it's session 2 or 3, you'll talk about what happened during the prior week, and, if you need to go over any write-ups or if any remaining business from prior week, you'll go over that. Essentially, when that is done, your preceptor will take you in pairs and will get you introduced to your patient. So they'll take pair number 1, get them introduced to patient 1. They'll take the second pair of students and get them connected to the second patient. And then the preceptor will split their time between those two groups of students during the bedside session time. So different preceptors have a different styles of how they split their time, but they should be at the bedside watching history take place, watching the physical exam take place. At the very latest, at 4 o'clock at the very latest, the whole group should meet up. And, you can meet at the nurse's station, wherever. You can find a conference room, you can find a table to sit down, and you should have at least 1 hour of the time period to discuss both cases, to go through each case and discuss what you think is going on. Your preceptor has an opportunity to give you feedback on what he or she observed regarding the history taking and physical examination. As the course evolves, that's also a time when your preceptor might say, look, you heard some crackles at the lung base, and it sounds like you might have heard a particular kind of heart sound. Why don't we go to the electronic health record? Let's pull up the chest x-ray. Let's look at the echo result, etc. So it's also a chance, especially after you gain a little more experience and get some of the fundamentals down, it may be a chance to go to the health record to kind of correlate what you're obtaining with other data in the chart. In general, though, your write-up will be based not on labs, not on x-rays or chest or MRIs or things like that, EKGs. It'll be based on the history and physical that you're obtaining. Okay? So let's think about how that time in the afternoon evolves. Let's say, you're starting off with student A conducting the history, and student B is going to be doing the physical exam, right? And then the following week you'll switch, or the following time you're at the bedside. So what happens is student A, goes ahead and starts taking the history. Meanwhile, student B is watching. Student B is taking notes about what information is being obtained. They're keeping track of what history is being obtained and what is still missing. So if student A gets lost, student B can help out and say, you haven't taken the surgical history yet. Or, you forgot the medication history. So in as gentle a way as possible, student B can assist student A's development. Student B should also be keeping track of the main problems that are being elicited, including, especially the primary problem the patient came in with, should be keeping track of what they think the differential diagnosis is. Okay? Student B should also be helping keeping track of time. You don't want to spend more than an hour really at the bedside because there'll be time spent before going to the bedside, there'll be time spent afterwards. In general, an hour total at the bedside is about right in terms of what you want to shoot for. Once the history taking is over, what we encourage you to do is student A and B to step outside of the room. And of course, recognize that if you're in with a group of 4 students, students C and D are doing this at the same time in a different room with a different patient, right? But essentially, after the history is taken, we want student A or student B to say to your patient, Ms. Thompson, thanks so much for discussing your situation with us. We're just going to step outside for a minute and, talk about what's been going on with you so we can come back inside the room in a few minutes to conduct a physical exam. Does that sound okay? All right, so get the patient's permission. And then what you're going to do is you're going to step outside and conduct something that we call a clinical reasoning timeout. What you're going to do during that timeout is go over the history and the history that you've obtained thus far. Think about what's missing. You might realize, oh man, we totally forgot to get the, social history regarding where they live. You can also think about what you know about the case. What do you think the differential is? If you need to look something up, pull out a pocket handbook. Get your phone out or go to the nurse's station. Get onto Harrison's or Up to Date. This is a chance for you to kind of try to get a sense, grapple with what you know, and what you need to look up, what you think the differential is, and what additional history you need to obtain. At the same time you're thinking about the differential, it's a great chance for student B to start connecting the differential with what physical exam needs to be conducted. Okay? So if you say, gosh, I think, this patient may have blood clots in their legs, that's what's causing the pain. Well, we want to make sure to examine the leg when you go back in. So not only is student B going to do a thorough physical exam, and actually, the physical exam will be affected by how much exam you've learned up to that point. So for session 1, you've only learned, the general observation and HENT, and that's totally okay. You've learned the vital signs as well. So as you learn more of the physical, you're going to conduct more and more of the physical as the semester and year progresses. But the point is, during the clinical reasoning timeout, you're going to be starting to think about what physical you want to do and how it's related to your differential diagnosis. If your preceptor is in the room, let's say, and you've not learned yet the musculoskeletal exam, but it's a musculoskeletal complaint, even though you haven't learned it, that's a great chance for your preceptor to step in and say, hey, look, I know you guys haven't learned about inspecting joints yet, but let me just, inspect this patient's knee with you, given the fact that, she's coming in with very knee pain. I think one of the things we get concerned about is fluid in the joint, or maybe even an infected joint. So let me show you how to examine the knee. Okay, so feel free with your preceptor's help to do kind of improvisational learning based on what the patient has in case you haven't learned it yet. After the clinical reasoning timeout, you're going to come back in, okay? You're going to complete any physical that you feel needs to be done based on the gaps that you identified. And in addition, when you're done with that, student B is going to step in and conduct that physical exam. Meanwhile, student A is keeping notes on what's being learned in the physical and also helping with keeping time. Now, at the very latest, at 4 p.m., the whole group should meet with their preceptor to do the wrap-up. One thing I like to do with my teams is, early on in the semester, just share one another's phone numbers so that you can text one another to let, the whole group know where you are. Let's say the preceptor is with group 2. Meanwhile, group 1 is finished with their history and physical. They're done. So when they're finished, they don't have to linger in the patient's room if they don't want to. They can say goodbye to the patient, give the patient a thank you card, and they can text the rest of their team and say, look, we just finished up. We'll meet you guys, at the nursing station, or we'll meet you guys in the lounge, whatever it is. And so at some point, at the latest 4 o'clock, the whole team meets, they sit down, and you can figure out where to meet based on your preceptor's knowledge of the space that they're working in. And at that point, each pair of students will present their case. Please make note of the session details in your syllabus, because each week there's someone that's kind of responsible or on the hot seat to give a more formal oral presentation. Let that student go first. Let that student go first, give a little bit more formal oral presentation so they get practice at doing this. And then what you do is essentially talk about the case. The preceptor can give feedback on what he or she noticed regarding, what they noticed about you taking a history or physical. Start talking about the case. You might talk about what you think could be going on in terms of potential diagnoses, and then start to connect the history and physical to your differential. Okay, so you should leave the wrap-up session understanding for the primary complaint, what is at least the top 3 conditions I'm worried about, what history and physical argue for and against each of those possibilities. That's what you're going to use to populate your write-up, especially the assessment and plan component of it. Okay? And then we basically do that with both teams. So the whole team learns about both cases. And then what you can do if you haven't done it already is sign your thank you card. And I like to ask the preceptors to sign it as well and to actually walk it over to the patient, hand it to the patient. And I think it's very powerful to actually read what's on the inside of the card to the patient for a couple of reasons. One is it's a powerful form of communication. You're basically conveying to the patient how thankful you are for, helping you during a time when they are also sick, right? The second reason is we don't know or we can't assume the literacy level of our patient, or even, let's say, the visual, function of our patients. So maybe they're not able to read that card. So it's for those reasons, it's nice to go ahead and read it to them. A couple quick notes about the write-up assignments. There are examples of write-ups in courseworks called teaching tools. Don't use patients' names. Student A and B are going to share notes about what they obtained at the bedside, but they need to write their drafts independently. The only exception is basically the clinical reasoning week, the week before your first bedside, and also the very first bedside session. You'll be doing these in groups. And then what you want to do is email your write-up to your faculty members. If they have a Columbia email address, please use that. If they don't, make sure to use the hashtag encrypt in your subject line. So your subject line can say write-up, but somewhere there it should say hashtag no space encrypt. And that basically makes certain that that information is protected when you send that to your preceptor. Okay, so Monday students, your write-up is due on Friday at 5. Thursday students, due Monday at 5. And make sure to get them in on time. You're going to also be asked to load it up onto courseworks as well as one of the assignments, so we can just check in to see how you guys are doing. Quick caveat, the only session that's kind of different is bedside session 1. What happens in bedside session 1 is you have 2 patients. The first patient, you're going to watch your preceptor do a focused history and physical. So that's different, isn't it? And so basically you're just going to be learning from their example. How do they, approach the patient in a respectful way? How do they do a streamlined history and physical? Yours this year and in medical school is going to be more, robust than their focused. But it's something to just kind of learn from in terms of their basic demeanor, how they sequence the maneuvers, and just their clinical approach. For patient number 2, here's how the setup is going to work. Student A elicits the history. Student B will come in, check the blood pressure, heart rate, respiratory rate, HENT checklist. Okay, use that same checklist that you use in the Sim Center. Try to internalize it, memorize it. Student C comes in and does the cranial nerve exam. And then student D has been taking notes the whole time. And during the wrap-up period, it'll be student D that actually delivers the oral presentation to the whole group to get practice. So I hope that helps. And have a great time at your first bedside session. Please be in touch if you have any questions. Be well and best of luck.